about why you'd have to come in for a prostate biopsy. Something has triggered the doctor to require this for you. In this case, the why is answered with an elevated PSA, a possible asymmetric tissue when they did the digital rectal examination, or a previous biopsy might have shown normal, but your PSA is still elevated. So in that case, we might go to another level of why. So let's take a look, first of all, at this last one, which is previous biopsy. If we're still seeing some contrasting data, if we're still seeing some contrary data, then we probably go ahead and order an MRI to get a little better imaging. All right, what then are the risks involved for you for this procedure? These are most of these are temporary, remember this. So you might see some blood in your urine, you might see some blood in the seminal fluid, you might even come down with a bit of an infection. Regardless, if you do end up with one of these risk factors showing as a symptom, make sure you contact the doctor, especially if you're running a fever or there's some pain in the lower abdominal area after we've done the biopsy. All right, what's your job in this? So the preparation for you is, one, make sure we check for infection in your urine, so we'll do a urinalysis on you. So that's one preparation, because if you're infected, we're not going to go through with the procedure. We're going to take care of that first, because that's primary. Second, get off the NSAIDs. All right, these are all blood thinners. We don't want those in your system for this procedure. Next, we're going to cleanse ourselves as if we're going to go do a colonoscopy, so we'll do that. Next, if the doctor has prescribed for you antibiotics, make sure you take them, and you take them as they are prescribed. So moving on, what about your results? Well, this is what you can expect. You're going to get a gross description, and that is what we're looking at as far as color and consistency of those cells and tissues. Second, what kind of cells are they? Are they benign, non-cancerous? That's what we're looking for. That's the best results we could have. If they are malignant, they're cancerous, then we're going to move into other procedures and other tests and management. Next, we move on to grading. This is something the pathologist does, and we use something called a Gleason scale. 2 to 10 is usually the scale that they use. The lower the number in that Gleason score, the best for you. The thing you have to understand is this prostate biopsy was triggered by something that required we go a little bit further in our diagnostic testing for you. Make sure we eliminate the possibility of cancer. All right, get to the urologist, get this done if they require it, get yourself on that path to recovery.